A 35-year-old male presents with chronic shoulder pain, swelling, and mechanical locking. I am showing you an AP radiograph and axial proton density and post-contrast fat-saturated T1 weighted magnetic resonance images of the shoulder. Please describe the findings.
The radiograph demonstrates multiple, well-defined, uniformly sized calcified, or osteochondral bodies within the shoulder joint recesses. The magnetic resonance images confirm these are fat-containing osteochondral bodies located within the subscapular recess, with no significant joint space narrowing.
What is your primary diagnostic concern?
The presence of numerous, uniformly sized, intra-articular osteochondral bodies in a joint with preserved cartilage is characteristic of primary synovial osteochondromatosis.
What is the underlying pathophysiology of this condition?
It is an uncommon, benign metaplastic process where the synovium undergoes chondroid metaplasia, forming cartilaginous nodules that eventually calcify, ossify, and detach into the joint space.
What are the three clinical phases of primary synovial osteochondromatosis?
Phase 1 involves active synovial disease without loose bodies. Phase 2 is a transitional phase with both active synovial proliferation and loose bodies. Phase 3 shows loose bodies present, but the active synovial proliferation has subsided.
How do you distinguish primary synovial osteochondromatosis from secondary osteochondromatosis on radiographs?
Primary disease features numerous, small, uniformly sized bodies with a preserved joint space. Secondary disease is secondary to trauma or osteoarthritis, featuring fewer, larger, and variably sized bodies with pre-existing joint degeneration.
Why is magnetic resonance imaging particularly valuable in diagnosing synovial chondromatosis? And what is a classic radiographic sign of calcification?
Magnetic resonance imaging is valuable because up to 1/3 of cases do not calcify, showing only cartilaginous nodules. Radiographically, the classic sign is the rings and arcs pattern of calcification, indicating a chondroid matrix.
What is the differential diagnosis for multiple loose bodies or soft tissue nodules in the shoulder?
Differentials include secondary osteochondromatosis, rheumatoid arthritis with rice bodies, and synovial chondrosarcoma. Rice bodies appear as multiple tiny low-signal nodules on T1 and T2, but lack marrow, fat, or calcification.
Finally, what are your clinical management recommendations?
I recommend referral to an orthopedic surgeon. Treatment for active phases is loose body removal and complete synovectomy to reduce recurrence, whereas inactive phase 3 requires loose body removal alone.